Welcome to Chapter 47, Lower GI Problems. There's a lot of different subjects to cover in lower GI, so I'm going to kind of break it down of things you should look at when you're working through your study guide. So the first section that you look at is diarrhea. Be thinking what kind of isolation you're going to use with these patients, what medications to use, and when not to use them. Just a reminder that antidiarrheals are not always the best idea with certain patients, especially infectious patients. And then, especially for inpatient, be thinking C. diff, right? C. diff is when they have antibiotic resistance. So that's something we really want to be aware of. The antibiotics change the flora and cause this super infectious diarrhea. So what are you going to be looking for in those patients, especially for patients that have been in the hospital on antibiotics? The next section is constipation. What are the risk factors and diseases connected to constipation, and how will you educate your patients on preventing constipation? The next section talks about acute abdominal pain. How will this manifest in a patient? Make sure to review Table 4712, particularly the interventions. What are you going to do as a nurse? How will you manage this patient as a nurse? What are you going to be looking for? It kind of is a shorter section and it's very broad because acute abdominal pain can be caused by a lot of different reasons, but make sure to review especially that table. That will be helpful. Abdominal trauma. This can be caused by a lot of different things. It could be caused by a gunshot wound, motor vehicle accidents, many different reasons. So make sure to review Table 4713, again, especially the interventions. Be thinking, is this emergency? Think ABCs, right? Airway, breathing, circulation. Those are your priorities. Are they bleeding somewhere? Sometimes these patients get what we call retroperitoneal bleeds. What that means is they're bleeding into the space behind the peritoneum, and so it kind of hides itself. So be thinking, how can I assess that? What can I be looking for? And always think ABCs. Chronic abdominal pain, a very broad section again. Look at the common causes and treatment, because really the treatment depends on the cause. So there's lots of different causes of chronic abdominal pain. And then IBS. What causes IBS exacerbations? How is it diagnosed? This one is a little bit tougher because it's not black and white like a lot of our other treatments, a lot of our other diseases. So what is the goal of the treatment? Lower GI, the inflammatory disorders. There's three big ones that you want to think of: appendicitis, peritonitis, and gastroenteritis. The first one being appendicitis. Think your clinical manifestation. Where's the pain at? What does it look like? And where exactly is it located? That kind of gives us the aha, this is appendicitis. What is the standard treatment? Most of the time it is going to surgery to get it taken out. Be aware of perforation, right? This is when this inflammation gets so bad in the appendix that it actually bursts. They're going to need IV antibiotics and really monitored for sepsis, because this can cause peritonitis, also known as hot belly in a lot of hospitals. You'll hear somebody like, "Oh, that is definitely a hot belly." That being is the idea that there's so much inflammation that it's just kind of a breeding ground for issues in the stomach or in the belly. Know the difference between primary and secondary, and what symptoms. What are you going to look for out for as a nurse, and what are the complications? These patients are sick and they can go downhill very quickly. So be monitoring for things like sepsis, hypovolemic shock, things like that. So when you're reading the peritonitis section, be thinking, this is probably more of an emergent situation that I really need to watch closely. And the last one is gastroenteritis, which is kind of the opposite of peritonitis, because most of the time it doesn't need hospitalization. If they're in the hospital, a lot of times it's exacerbation of other issues, but be thinking of hydration, right? How are we going to keep this patient hydrated, electrolytes, things like that. The inflammatory bowel disease, the two main ones, ulcerative colitis versus Crohn's. Take your time to fill out this section, and especially comparing ulcerative colitis versus Crohn's. How would I tell the difference between the two? If a patient walked in right now, and I want to diagnose ulcerative colitis versus Crohn's, what are those main differences? How would I educate these patients with these diseases? What medications would I expect these patients to be on? And what kind of complications should I be monitoring for? In general, Crohn's is known to be worse than ulcerative colitis, so be looking specifically for flare-ups, different issues that can happen. And it always comes back to education. How will I educate the patient on the nutritional needs for these diseases? And bowel obstruction. There's many different types and causes of bowel obstruction. How will this be diagnosed? There's some very specific ways to look at bowel obstructions, but sometimes they are not, again, black and white and as clear. What is your worst case scenario with a bowel obstruction? These, again, can go downhill very fast. So be looking at those worst case scenarios and what you're going to be looking for as a nurse. And as a nurse, how will you assess and care for these patients? Overall, lower GI can cause some very big issues with inflammation and infection. So be looking at just different ways as a nurse how you can assess and care for these patients, and always be thinking ABCs.